If your waistline is pushing forward even when your overall weight isn't extreme, I want you to pay attention. That outward curve is often visceral fat, fat packed deep around the liver, pancreas, and intestines. Compared with the pinchable fat under the skin, visceral fat is more metabolically active and more inflammatory. It raises the odds of type 2 diabetes, fatty liver disease, and coronary artery disease. The good news is we can change it, safely, methodically, and faster than most people realize, by calming insulin, repairing the gut-liver axis, and tuning your daily rhythms. Let's start with insulin. After you eat, glucose rises and your pancreas releases insulin to move that glucose into muscle and liver. That's normal. What isn't normal is the modern pattern: frequent snacking, refined carbohydrates, sweetened drinks, and ultra-processed foods that digest quickly. Insulin spikes, starts to fall, and before it can normalize, we snack again. Over months to years, tissues become less responsive, what we call insulin resistance, so your body compensates by making more insulin. You can have normal fasting glucose and a normal A1C while carrying chronically high insulin in the background. That high insulin state promotes fat storage, especially visceral fat, and it also tightens arteries, thickens smooth muscle in vessel walls, and makes blood more prone to clotting. This is one major reason I see heart disease in people in their 30s and 40s who don't yet meet criteria for diabetes. How do we reverse that physiology? We lower insulin gently and consistently. You can do that with two levers: what you eat and when you eat. On the when, time-restricted eating is a powerful tool for many adults. A simple starting structure is 12 hours without calories and 12 hours with food. After 2 to 3 weeks, most people can progress to 18-6, an 18-hour fasting window with a 6-hour eating window, using water, black coffee, or unsweetened tea during the fast. Why it helps? Liver and muscle glycogen are used first. After roughly 12 hours, fat begins to supply more energy, and visceral depots tend to be mobilized early. Importantly, fasting isn't the same as chronic calorie restriction. Long-term calorie restriction can slow resting metabolic rate and take muscle with fat. Thoughtful time-restricted eating preserves lean mass better, especially when you pair it with resistance training and adequate protein during the eating window. Extended fasts beyond 24 to 36 hours should be individualized and medically supervised, particularly for people with diabetes, on glucose-lowering or blood pressure medications, or with a history of disordered eating. This is not a do-it-alone challenge. On the what, prioritize real food with fiber, protein, and healthy fats. Build meals around non-starchy vegetables. Add quality protein, eggs, fish, poultry, tofu, or legumes. Include healthy fats such as extra virgin olive oil, avocado, and nuts, and minimize ultra-processed products that combine refined starches with seed oils and flavor enhancers. Whole fruit is fine in modest portions inside your eating window, but fruit juice behaves like sugar water and spikes insulin quickly. If rice is a staple for you, there are simple ways to blunt its glycemic punch. Rinse and soak, cook in excess water and drain, then cool and reheat. That process increases resistant starch, carbohydrate that resists digestion and becomes fuel for beneficial gut microbes. And a quick note on healthy-sounding foods. Most packaged protein bars and healthy snacks remain concentrated sources of refined carbs, sweeteners, and seed oils. The fewer labels you read, the better your metabolic health tends to be. Exercise is your second insulin lever. You don't need to live on a treadmill. A balanced plan looks like this: 2 to 3 brief sessions per week of high-intensity intervals, or sprint efforts separated by full recovery. 2 to 3 sessions of resistance work emphasizing major muscle groups, and modest aerobic activity for endurance and enjoyment. Think 15 to 20 minutes of steady cycling, rowing, brisk walking, or jogging on days you're not doing intervals. If you practice time-restricted eating, many people feel strong training near the end of the fasted window, then breaking the fast with protein afterward. That said, training should respect context. Some individuals, especially pregnant patients, those with menstrual irregularities, or those with specific medical conditions, do better with a small pre-workout snack. Bio-individuality matters. We adjust for symptoms, recovery, and labs. Now the gut-liver-heart connection. Your intestines host trillions of microbes that help maintain the gut barrier and produce short-chain fatty acids and vitamins. When that ecosystem is disrupted by low-fiber diets, chronic stress, poor sleep, alcohol, or certain infections, the intestinal barrier can become leaky, allowing bacterial fragments to reach the liver and bloodstream. That can amplify systemic inflammation, worsen insulin resistance, and promote fatty liver. Restoration starts with fiber. Aim for a wide variety of plants across the week, not just a big salad of the same greens every day. Many of my patients benefit from adding a soluble fiber such as inulin or partially hydrolyzed gar gum. Include fermented foods, kefir, plain yogurt, kimchi, sauerkraut, if you tolerate them. Sleep is not optional here. Even one night of curtailed sleep can transiently worsen insulin sensitivity the next day. Protect 7 to 9 hours, keep a consistent schedule, dim evening light, and keep the room cool and dark. Manage stress with breath work, mindfulness, and yes, joyful movement and social connection. Your autonomic nervous system, the balance between fight or flight and rest and repair, is directly wired to your gut and heart through the vagus nerve. Simple drills like 4 seconds in and 8 seconds out, breathing for 5 to 10 minutes, can enhance vagal tone, lower resting heart rate, and improve heart rate variability over time. Let's talk about environmental triggers. Toxins isn't a hand wave, it's a practical bucket. Cigarette smoke and excess alcohol, pesticides and herbicides, heavy metals in some settings, and damp indoor environments that allow mold growth. Not every musty room equals illness, and estimates about how common mold toxicity is vary widely. But if you have chronic sinus symptoms, cough, or unexplained fatigue, and you live in or frequently visit a water-damaged building, address the building first. Fix leaks, improve ventilation, consider professional remediation when needed, and reduce humidity. Medical evaluation should be individualized. We anchor recommendations to symptoms, exposure history, and objective findings, rather than labels alone. Supplements should support, not substitute, foundations. For bone and vascular health, the combination of vitamin D3 and vitamin K2 is often more rational than high-dose calcium pills. D3 supports calcium absorption. K2 helps direct calcium toward bone and away from soft tissues. Many adults in the US are low in omega-3 fatty acids. If you don't eat fatty fish regularly, consider a quality EPA/DHA supplement. Magnesium glycinate can support sleep and muscle relaxation for some people. Probiotics are nuanced. Spore-based products can survive stomach acid, but they're adjuncts to fiber-rich diet and fermented foods, not cures. Always involve your clinician if you're on blood thinners, have kidney disease, or take multiple medications. What about cholesterol? LDL is not a toxin, it's a transport particle. Risk depends on how much LDL you have, how long it circulates, and how easily it becomes oxidized and small dense. Insulin resistance, smoking, chronic inflammation, and certain diets make LDL more atherogenic. If your standard lipid panel is borderline but your metabolic signs are off, central adiposity, elevated triglycerides, low HDL, elevated fasting insulin, ask about an advanced lipid panel, apolipoprotein B, and markers of inflammation such as hs-CRP. Lifestyle can powerfully improve these. Some people, based on age, family history, and risk calculators, still benefit from medications. That decision is personalized. The point is not lower LDL at all costs, but lower overall atherosclerotic risk, which includes improving insulin sensitivity, calming inflammation, and, when indicated, pharmacologic therapy. 2 tests I find especially helpful for midlife adults who want clarity. First, a coronary artery calcium, CAC, score, a low radiation CT that detects calcified plaque. A score of 0 is reassuring. A positive score doesn't mean a heart attack is imminent. but it moves you from theoretical to documented atherosclerosis and justifies aggressive risk reduction. Second, a comprehensive metabolic inflammation panel, fasting glucose and insulin, A1C, lipids with ApoB, hs-CRP, liver enzymes, and, when appropriate, iron studies and thyroid. If blood pressure has crept up, screen for sleep apnea. Treating apnea often improves blood pressure and daytime energy without adding medications. Caffeine sits in the dose and timing category. 1 to 2 coffees per day can be cardiometabolic neutral or even favorable for many people, likely because of polyphenols and soluble fiber, not because of the stimulant. But high intakes and late timing elevate sympathetic tone, worsen sleep, and can trigger palpitations in susceptible people. If you experience palpitations, get evaluated, especially if you have chest pain, dizziness, or known structural heart disease. For otherwise healthy people with occasional flutter, reduce stimulants, hydrate, check electrolytes, and work on vagal tone. Again, that 4 to 8 breathing is simple and effective. Let me pull this into a concrete plan you can start this month with medical supervision as needed. First, define your eating window. If you're new to this, aim for 12-12 for 2 weeks, then try 18-6 for another 2. During the fast, water, black coffee, or unsweetened tea only. During the eating window, 2 real food meals emphasizing fiber, protein, and healthy fats. Avoid grazing. Second, train with intent. 2 to 3 days per week of short intervals, 30 to 45 seconds hard, 45 to 90 seconds easy for 8 to 10 rounds. 2 to 3 days of resistance training focusing on legs, glutes, back, chest, and core. Add easy cardio or walking for enjoyment and recovery. Third, fortify the gut-liver axis. Target at least 30 different plant foods weekly: vegetables, herbs, spices, legumes, nuts, seeds, whole fruit. Consider a daily serving of fermented food and, if needed, a scoop of soluble fiber. Limit alcohol. Protect sleep with a consistent wind-down and a cool, dark room. Fourth, clean up the inputs. Cook most of your meals. Use extra virgin olive oil for dressings and moderate heat cooking, and a small amount of butter, ghee, or avocado coconut oil for higher heat. Avoid routinely charred or blackened foods. If rice is part of your culture, use the rinse, soak, cook, and cool method, and enjoy it in modest portions next to protein and fiber. Fifth, measure what matters. Discuss a CAC score if you're 40 plus or younger with strong family history. Get fasting labs that include insulin, A1C, lipids with ApoB, and hs-CRP. If blood pressure or energy is an issue, evaluate sleep, especially snoring, witnessed apneas, or morning headaches. Sixth, practice a daily vagal reset. Set a 10-minute timer. Inhale for 4, exhale for 8, eyes soft or closed. Add a brief cold splash to the face in the morning if you tolerate it, and find something that makes you genuinely laugh every day. Those sound small. They aren't. They shift the chemistry that governs blood vessels, inflammation, and recovery. None of this is a quick fix. It's a coherent physiology. Lower insulin and you'll draw from visceral fat. Feed your microbes and you'll lower inflammation. Sleep and breathe well, and your autonomic balance will favor repair. Train your muscles and you'll raise your glucose sink and resting metabolic rate. Measure progress with objective markers so you can personalize the plan, adjust for your life, and, most importantly, stick with it. If you do these things consistently, you don't just shrink a waist measurement. You change the internal environment that creates plaque, high blood pressure, fatty liver, and the constant fatigue that makes life feel heavier than it should. That's the real win. More years with a stronger heart and a clearer mind, and more good days between now and then.